Hello, so this video is going to be about our experience with healthcare here. So South Korea is on a single payer national health insurance. This is my first time ever being under this kind of insurance. So the first part of this video is going to give you like basic information about how it works. Then I'm going to cut away to our first visit to a clinic, and then I'll end it with what I've kind of experienced as the pros and cons personally to this. So before this video, because health insurance, okay, so I worked in healthcare for over a decade and know a lot about how the American system works and Medicare and stuff like that. But this is totally different. So I did some research and I wrote down some notes so that I could make sure what I was saying to you was legit and not just my opinion on things. So it is a national health insurance plan. It is required. So I didn't see anything about fines if you don't do it, but it sounds like you don't even have the option to not do it. But if you're self-employed, how do they know? Anyway, but you do pay into it, so you pay a premium. You pay premiums out of your checks, and then most employers help contribute towards that. Our premium is cheap. It's like maybe 5% out of our paycheck. But it's because of the coverage. So I'll get into that in a minute. But it's about 5%, and it's the only insurance that we're on. Most people in Korea have to get a private insurance plan as well. So it is not like Medicaid where you don't pay for it, you just get free healthcare. You do pay into it, and there are co-pays and out-of-pocket costs and things like that. So one of the problems that they ran into a few years ago, I think part of why socialized healthcare can be a divisive topic sometimes is because it's a lot of government control and maybe not always financially sustainable. And if it's not financially sustainable and it's run by the government, guess what they do to make up for the financial instability? They tax you more, right? So I think that's why it's kind of a divisive topic. So it's been very interesting to live under it out here. So as I was researching, one of the difficulties that they had, because it's such an easy thing to get on, so as a foreigner, when I come here, we have to all apply for an alien registration card because we're not citizens, but we are long-term residents. We're not tourists. So there are some societal benefits that we get to partake in because we are long-term residents, and that's decided by our visa type, okay? So national health insurance is one of those things. But to qualify for national health insurance, we have to get approved for an alien registration card, and then that ID number also serves kind of as our insurance number. You don't get an insurance card here. Your ARC, alien registration card, is what you show. So there's no insurance card, there's no policy number, nothing like that. Your ARC card, your ARC number is what shows you're enrolled in the National Health Insurance Plan. So it's pretty simple based on your visa and that you're working a job. Your employer has to sign you up for the National Health Insurance Plan. And the premiums, like I said, are pretty cheap. So a few years ago, they just hit a point where they had to start making some rules, because when it's easy to get on and it's cheap and it covers a lot of stuff, your money going out, the government's money going out to pay for your stuff being done, far exceeds the amount of premiums they got. So for example, in 2 years' time, a typical foreigner would pay in about $2,400 in 2 years, okay? So if you look at the whole 2 years, a foreigner would pay in premiums of around $2,400. But in 2 years, foreigners accounted for over $36 million of healthcare resources. And each foreigner is only paying in $2,400 in those 2 years. So what was happening was they called it dine and dash, where foreigners would come. Let's say I have cancer, and I come, I get a job here, I get my visa approved. I think they don't allow you to not get coverage if you have a pre-existing condition, which a lot of people feel like pre-existing conditions should not be considered. The problem though is if you don't consider my pre-existing condition, I'm still paying the same cheap premium every month, but I come here knowing I can get my cancer treated here. So they had this big problem where it was just not sustainable because foreigners were doing this thing they called dine and dash. Come in, they have a health problem, they come in, they get a job, they get into the national health insurance, they stay here long enough to get millions of dollars of treatment and pay only hundreds of dollars in premiums, and then they are done with treatment, they quit their job, they go back to their home country. So that was a problem, not sustainable. So they made the rules a little stricter, and I think you have to commit to at least 6 months of a job or something like that I read, but even that, $600 in premiums, right? So there's that problem with it being sustainable. I also looked up, we've only had to use national health insurance for our prescriptions, like Eli's EpiPen, my Lexapro, Jordan's nebulizer. We have not had to actually go for a sick visit or anything, thank God. But the typical coverage when you are under national health insurance, the typical coverage is about 60% of your medical bills will be covered, leaving 40% as your out of pocket. Therefore, about 80% of the population in Korea also pay premiums for a private health insurance that helps lower some of that out-of-pocket cost. So they're having to be on 2 different health insurance plans. There are copays with everything as well. So a typical copay for an inpatient hospital stay is 20%, and there's no cap. So in America, in private insurance companies, there's an out-of-pocket maximum or a lifetime maximum. And once you hit that, in the out-of-pocket maximum, let's say you pay 20% of your bill, but if you spend $10,000, if your 20% adds up to be $10,000 this year, then the insurance kicks in at 100%. There's not that here. So you're never going to meet it. You will always be paying. And the copays are about 20% for inpatient stays, 30 to 50% for anything outpatient, and then 35 to 40% for pharmacy. So when I've gotten our prescriptions filled, it's really not cost me any less than what it cost in America as far as my copays. What's really interesting is that Korea's health, their medical programs here are top-notch, ranked very high in the world. However, when polled, only about a third of the Korean population says they would consider themselves to be in good health. So that was very interesting stat to me. The other thing that is concerning the health ministry here is the elderly population. So life expectancy here is 80 years old, okay? Well, right now, they're at about a 14% population that's over 65 years old. 14% over 65. But come this next generation, they're predicting that by 2050, 40% of their population will be 65 and over. And that is something they're very concerned about because, again, the premiums going in does not cover the use of the healthcare system. So once almost half the population is elderly, they're foreseeing that they're going to have a problem with sustainability. And what's happening, and like what happened with the dine and dash thing, the foreigners paying premiums and then using up so many resources, what they end up doing is then increasing everybody's premiums or increasing taxes, because national health insurance is supported by a tobacco surcharge, employee or personal contributions, and government subsidies. So if you're having to up all of that, then you're going to see an increase in your own premium and an increase in just general taxes, because government subsidies have to help cover for this. So that's what they've been seeing, is a rise of how much we pay for this national health insurance, because somebody's got to pay for it, right? Nothing's free. Somebody pays for it. The other thing that I found interesting is that because everybody's automatically on national health insurance, the average person here will see a doctor 16 times a year. Whereas in countries that do not have a national health insurance plan, the person averages 6 visits a year. So what they're seeing here is that when in doubt, people go to the doctor. And I have experienced that here. Like, somebody has a sore throat, they go to the hospital. Somebody has a fever, they go to the hospital. Like, it seems to be odd that if I don't feel well, or like I had a cold and I didn't go to the hospital, and that was a little odd, I guess, to some, because the instinct is to just go to the hospital. And they go to the hospital because there's really not a strong, in America, what we would call like a primary care system, you know, general practitioners, family care, that kind of thing. There's really not a strong system of that here, especially not English speaking, Like you're gonna see in the next video, we had to go 45 minutes away to find a clinic that had English speaking staff. Now that's a unique thing to us because we don't speak Korean, right? And foreign population here is so minuscule that we don't matter enough for any change like that to happen, for any of that really to be addressed. But visits are quite high, and many of those 16 visits a year by people really would not rise to the level of needing to have being seen by a doctor or a hospital. So there's concern that because people feel they could just go visit, go, again, their premiums aren't covering what they're using. So there's a sustainability concern with that. So what you're about to see is just a minute or two of our little visit, and then I'll come back around and kind of tell you the pros and cons that we have found with our personal experience. We're making our first visit to a doctor's office. It took me a while to find one that where the staff all speak English and where we can get Eli's EpiPens. But we found one, and it's in Itaewon, which is about a 40-minute bus ride. And now we're heading to have our first.
Wait, I want to get videotaped. See, we got to do the intro to the video, so I'm going to do it. Welcome back to the Lincoln video.
In and out of the doctor's office within 7 minutes. Just one little piece of paper I had to fill out for each kid, minimal information. Then they weighed them and took their height. Then they took us back to what I thought would be like a patient room. But no, it's the doctor's office, and he's in a sweater and jeans. And they sit down, he asks them some questions, we get Eli's EpiPen, we get a refill for albuterol, we walk out the door. Pretty good deal. Okay, so a little more about our personal experience. As you saw there, part of our dilemma is we're foreigners and we don't know Korean. Right? So Itaewon is the very super international area of Seoul, and we found an English clinic out there. And they were great, by the way. Okay, so one thing that's really interesting that we've experienced personally, the process, once you do find a doctor or whatever, the process is so smooth and quick. There's not 5 million pieces of government paperwork to fill out. You know, in America, you're filling out all this stuff because they don't want you to sue them. And then there's like HIPAA disclosure and blah, you know, all this other stuff. And for Medicare, trying to enroll in like Medicare or Medicaid, the paperwork is insane. So out here, I was surprised because it's government insurance, right? But I mean, nothing, like barely anything. They asked me name, date of birth, sex, address, phone number. You got any problem? And that was like it. And they needed our ARC numbers, and that was it. We didn't even go back to a patient room. It's the doctor's office, like a professional office. He's sitting at his desk at a computer. He says, okay, what you got going on? Eli says, I'm allergic to nuts. I use an EpiPen. Okay. What you got going on? I have asthma. I'm out of my inhaler. Okay. Thank you guys. I'll see you later. That was it. So one of the pros has been the process itself is not burdensome. Now, here's one of the difficult parts, though. Not every clinic or doctor's office can prescribe everything, and not every pharmacy offers everything. So, Eli's EpiPen, for example, not every clinic or doctor's office can prescribe that, and not every pharmacy has it. In fact, the clinic in Itaewon had to order it for us to be there. So that was interesting. So that drug in particular is kind of difficult to get, and not everybody is allowed to even prescribe it. My Lexapro is a big problem, and that's because it's a mental health diagnosis, anxiety, and that is really not looked at very well here in Korea. So one of the stats that I saw really sadly is that one of the highest suicide rates. And so the government has been working really, really hard to improve their whole mental health programs and offerings. But it's kind of taboo out here to admit, like, it's a big deal, and I'm even admitting it right now. And they ask you questions on your visa application and stuff. So if I had anything really serious, that might be a problem even for a visa. So finding a doctor's office that could prescribe my Lexapro, that was really, really hard. And then I had to go to 3 different pharmacies to finally find a pharmacy that could fill the prescription. And that pharmacy ended up having to be a pharmacy at a hospital. So all these little pharmacies around here, no, they ain't gonna have that. So that's one of the cons, is that there does seem to be restrictions or stricter rules based on the drug that you need and your diagnosis. So that's been a little unfortunate, especially because, gosh, anxiety is such a typical common diagnosis. So that was kind of interesting. But everything's been smooth as far as the process, if you can find a place that will offer your drug and or fill it. Now, again, we've not had to do anything big. We've not had to go for a sick visit. We've not had to go for a hospital visit, nothing like that, thank God. But I feel like that process is probably pretty darn smooth. But we would be paying probably a decent chunk out of pocket based on the percentages that I saw. And we don't have any plans to get private insurance. I'm sure that we can, even as a foreigner, but I just haven't even bothered looking into that process yet. So that's kind of been our experience so far with the national health insurance. Like everything else, there's pros and cons, and our personal experience might be very different from other people's personal experiences. So that's kind of been our story here. I hope that answers some questions. Let me know if you have any others.